Is this you specifically, or all PTs do this? Or most PTs?
Most PTs do this. This is how we're trained. You know, PTs are really like, we solve puzzles. Like when you look at someone's body, I have lower back pain, we have to do a diagnostic evaluation to figure out where it's coming from. So it's a puzzle that we're putting together. You have this, and this. What's happening? And now most good PTs are very good at orthopedics and neurological, because those are two different things. You need to do a deep dive of a neurological assessment to see if it's really coming from the nerves rather than just is it muscular or joint, right? So most PTs do this inherently.